Is Alyssa Thorner, and I work in the Johns Hopkins Breast Cancer Program. I'd like to welcome you today for joining our webinar, Sleep, Fatigue, and Breast Cancer. Today we have a really special guest, Dr. Tracy Vannorsdall. She's an assistant professor of psychiatry and behavioral science in the Johns Hopkins School of Medicine. She has an expertise in neuropsychology of cancer and its treatments. Throughout this webinar, I'm going to ask that you mute your line and turn your video off. At the end of the presentation, we'll try to get to as many questions as possible. Please use the chat feature you see at the bottom of the screen. Send me the questions. We'll get to as many questions with Dr. Vannorsdall as we can within the hour. I'd like to thank everyone for joining us, and we'll spend the next hour talking about sleep, fatigue, and how it can impact breast cancer treatment and beyond. Dr. Vannorsdall, I'd like to welcome you. Thank you so much for joining us.
Thank you for having me. Let me see if I can manage the screen share here.
Wonderful.
Let's see here. I actually don't want to do that. We'll try it this way. We'll see what's going on here. And well, let me switch here. Sorry, folks. You would think after like 4 months of being on the Zoom platform, I would have this worked out.
I feel like it's getting better and better each time, but there's still not seamless. I think it's not an easy platform to always work on.
There we go. The switch platforms. That is what I need. Or switch screens. Okay, great. Wonderful. So thank you guys for having me. I appreciate this. And thanks for sticking with that awkwardness in the beginning. So I'm going to be talking about fatigue and sleep difficulties, which is sort of something that I often touch on with my patients. I focus a lot on cognition and thinking skills, but one of the main reasons that your thinking skills can be diminished is having chronic fatigue and sleep difficulties. And so this is a good chance to talk about those topics. And, you know, one of the things you'll hear me talk about a lot tonight is the need for sort of structure and routine. And I think that over these past several months, that has been something that we've all sort of struggled to reestablish in this new world. And getting our sleep and keeping it on track is sort of important for our mental well-being and our physical well-being. So, there we go. All right, so what I'm going to be talking about generally is two major topics, fatigue and sleep, and we'll start with fatigue. I'm going to talk a bit about sort of the purpose of fatigue and how it works in the body, how it's linked to cancer, and how we treat difficulties with fatigue. And then switch over to sleep and talk a bit about the basics of sort of our circadian rhythm, what are good sleep habits, and these are habits that are sort of scientifically based and they have good evidence for, rather than sort of just general thoughts on what's good for folks, and what tools are available to aid our sleep, what resources are available to folks who are really struggling with their sleep. So what is fatigue? We have a lot of different terms. They sort of overlap. There's no one agreed upon sort of definition. We could say you're fatigued. Are you sleepy? Are you tired? You have muscle weakness? All of these sort of wrap together in this idea of being depleted of your normal energy level. And there really is no agreed upon definition of fatigue. The field has not sort of put it down on paper and said, this is what we're going to call it. But it's been proposed to be difficulty with initiating or maintaining voluntary activities, reduced effort that results from your perceived exertion. So that's either sort of, you know, your muscle output or your sensory input, and other motivational factors, or just a decrease in your physical and mental performance that results from different biological factors. So we know that fatigue can be extremely disabling, and it's also really, really common in a number of conditions. Cancer, as I'll talk about tonight, but also multiple sclerosis fatigue is one of the sort of hallmark difficulties that individuals face. Individuals with movement disorders, strokes, brain injuries, chronic fatigue syndrome, all of these are associated with really heightened levels of fatigue. And so there's been a lot of research interest in sort of how we measure fatigue, how we treat it, how do we advise our patients who are having difficulty. And, you know, fatigue is very very much akin to pain in that it is subjective, right? I can't put you on a scale or draw your blood or do anything to get at the truth of what your pain is. It is how you experience it, and how you're able to convey that experience to others is sort of how we measure and appreciate your pain level or your fatigue level. Just like pain, there are central nervous system and peripheral biological aspects that come into play in terms of what causes the pain or fatigue, and what we need to do to sort of bring it back in line. We know for both pain and fatigue sort of what's going on in the brain, what that neural network looks like when somebody's experiencing fatigue. And we know that there are mechanistic or biological differences when somebody's having acute fatigue. So fatigue because you got up really early, or you worked very hard over the course of a week and you're extra tired on the weekend, versus chronic fatigue. And we'll sort of talk about that chronic form a bit more as we go. But fatigue itself is not a bad thing. It's an adaptive biological process. It is a signal from your body that you need to rest. You need to preserve energy after an intense bout of work, after a lack of, you've had sleep loss or a lack of sleep, and when the body's resources need to be sort of directed towards a different target. So if there is some kind of an infection brewing, your body's response is to sort of pull back, become fatigued, and let that energy go where it's needed to help keep you healthy. And fatigue is multidimensional. And by that, I mean that there are different ways of experiencing fatigue. And some of us may be prone to experiencing it in one major modality. Some people may experience across the board changes, but there's physical fatigue, so sort of difficulty carrying out physical activities, feeling like it's exhausting to stand, or you've lifted, you can't lift any more weights, you can't physically do it. There's also mental or cognitive fatigue, which is generally that sense of difficulty concentrating, staying on task, remaining focused, right? Or carrying out cognitive tasks. And then there are motivational changes, so your ability to sort of engage because of fatigue. And so down here along the bottom, we see sort of adaptive or physiological fatigue. It's something that's adaptive. It's proportional to your level of activity. So if you work hard, you have more fatigue. That makes sense. It's acute, it's short term, so it's improved by rest or sleep. So if you go for a really long run, then you take a really long nap at the end of the day. But this more pathological fatigue, where we see in the top panel, is not alleviated by sleep or rest. And it's really not in proportion to the type of activities or the extent of activities that you're engaged in. So you can have profound fatigue without going out and running miles or doing something that would seemingly cause you to be tired. And so patients will say, I have difficulty performing tasks. I don't feel motivated to do things. I can't concentrate. And you can sort of test them and see, well, yeah, you know what, your performance is reduced on physical or cognitive tasks. You're less effortful when I try to sort of tempt you with a treat, something that's rewarding. And so we know that there's sort of a pathological or unwell nature to this central chronic fatigue. We also know that the brain regions, without getting too much into the details of this, I just think it's important to note that there is sort of a mechanism underlying our process of fatigue, and it really tends to hit on these areas of arousal, brain regions that are important for arousal, which you would expect: arousal, vigilance, alertness, but also attentional capacity, so your ability to stay focused, your mood, and your ability to sort of regulate your mood and your motivation. So all of those brain areas are sort of linked tightly with the fatigue process. We also, when we think about what causes fatigue, inflammation is sort of the number one thing that our minds go to, other than sort of physical activity. But when we're thinking about fatigue that's coming on sort of on its own without you working hard to get yourself tired, inflammatory processes are often at play. So we know that if you have higher inflammation marker levels, that's associated with more fatigue and also with poor sleep quality. And if you take people in the general population and you look at their inflammatory markers, at one point in time, it predicts how tired they will be about 5 years down the line, right? We also know that women in particular tend to have a stronger link between their level of inflammation and their level of fatigue. That correlation is a bit more tight for women. And we know that inflammation, in addition to just the normal healthy population, that inflammatory processes are associated with fatigue in a number of different conditions, including cancer, MS, diabetes. And in fact, fatigue is really one of the first and most common ways that your body responds when the immune system has been activated, when something has sort of gone awry. Right. And we know that these inflammatory factors act on our nervous system, our brain and spinal cord, to cause physical and behavioral changes. So as we spoke about before, you're reducing energy, your thinking slows, you're sleeping perhaps more, your appetite goes down, you're less engaged. So if you think about sort of when you're getting sick, and this is a motivational shift to help you recover. So that it's that aspect of fatigue that's supposed to be sort of healing. And fatigue and cognition are closely linked. We know in patients with cancer, for instance, that there's a link between inflammation and fatigue levels and thinking skills before treatment even starts. There's this notion that having cancer in and of itself is an inflammatory process that then affects thinking skills and fatigue levels. And then the treatments themselves actually can cause some difficulty with fatigue, and there can be some lasting post-treatment fatigue difficulties and cognitive difficulties. It's also the case that how we judge our thinking skills, our perception of our cognition, is very, very tightly correlated with how we think about our cognitive fatigue. So how cognitively fatigued we are. Our thinking skills aren't necessarily linked very tightly with how physically fatigued we tend to get, but really it's that sort of mental fatigue that tends to be key. And those perceived cognitive difficulties and fatigue actually lead our brain to work harder, right? So even if you're able to perform a task, if you look at your brain, if you're in the brain MRI scanner and looking at what areas light up, which areas are sort of active during tasks, you see that people who are fatigued, they compensate, they overcompensate. So if normally a small area is required to do a task, and when you're fatigued, a larger brain area is required in order to perform that task normally. And that process of overcompensation or compensating itself is fatiguing when carried out over the long term. We know that fatigue is a stronger driver of distress than the type of cancer a patient has or the treatment type. And it has effects on their ability to function. Things take longer to do, you're more likely to make errors, your mental efficiency is not there. And so there's this entire notion of a cancer-related fatigue and a lot of sort of research that's been done to try to figure out sort of what's going on, what's the trajectory of these cognitive difficulties. And cancer-related fatigue in and of itself involves distressing, persistent, subjective sense of either physical, emotional, or cognitive tiredness that's not related, as I said, to what you've done. It doesn't tend to get relieved by your sleep or your degree of rest. It interferes with your functioning, and it's related to the cancer and its treatment. We know that it's very, very common, about 80 to even 100%, depending on the studies, of individuals with cancer will report fatigue at some point during their treatment or survivorship. But I think it's important to think about, well, sort of what do we know about the time course of this fatigue? When do we expect it to go away? Most importantly, right? So these are data. These are data from a fairly recent study of early stage breast cancer patients who were followed actually over 10 years, although the figure here that I'm showing you only goes out for about 2 years after treatment. And so what they found is that before surgery, fatigue was pretty low. About 9% of patients were sort of rating themselves above an established cutoff for saying, you've got a problematic level of fatigue. But that increased during chemotherapy. What we see here is time 1 over here, right here, where about half of the sample said, we're meeting criteria for having problematic levels of fatigue during their chemotherapy. And then at the end of chemotherapy at time 2, that stayed about the same, right? So about half of patients getting chemo are going to be really, really fatigued, which is not terribly surprising. But when you look 1 year after chemotherapy has ended, about 30% of women are still meeting that elevated criteria. You get 2 years out, it drops to about 12%, and that goes smaller and smaller over time, so that by the time you're around to 8, 9, 10 years out, it's only about 2 to 5% of women, at least in this study, that had lasting fatigue. And then these colored bars here, just to help explain the figure a little more. The blue is the number of patients who were tested at each visit, so some people dropped out of the study as it went. The green or yellowy lines are people who had persistent problems with fatigue throughout. And then there are other people who had just it was their first time having a blip of really high fatigue. So those persistent fatigue is sort of the important things, I think, to numbers to be looking at. And so this is for chemotherapy, sort of with or without hormonal treatment. But we also know that a lot of patients end up with radiotherapy as well, radiation. And so these are some data for cancer-related fatigue in oropharyngeal cancer patients who've got chemotherapy and radiation therapy, right? And so the mean baseline, and this figure is pretty wonky, so I will walk you through it, but before treatment, on a 0 to 9 scale, where 0 is no fatigue at all and 9 is really, really bad fatigue, the worst you can imagine. Before treatment, most people were doing pretty good, less than 1, right? But the average fatigue score at the completion of therapy, lasting to about a year after treatment, was closer to 7. So there's some real fatigue that can be associated with having radiotherapy, particularly perhaps to the sort of head and neck region. But generally, we think that cancer-related fatigue does improve over time. The general ballpark, based on, these were just 2 studies that I showed you, but that are more modern, sort of the most recent things that have been published. But if you look at the bulk of the literature, that really suggests that, after that first year of treatment, people start to notice that their fatigue tends to get back to normal. 1 to 5 years after treatment, maybe a third of women or individuals receiving at least chemotherapy will still have some cognitive difficulties. By 10 years out, we expect that that's less than 20%. A lot of studies show it to be sort of in the single digits, but certainly, it's something that can linger with folks for quite a while. And so what are the risk factors for developing fatigue? Well, in the cancer population, this is individuals who are younger, unmarried, so perhaps less social support, lower socioeconomic status, so less funds when money is a stressor. Fatigue is sort of one of the ways that we respond to stress. Patients with a lot of physical or psychological symptoms, so patients who are having more pain, more depression or anxiety, more loneliness, having coping styles that are not adaptive, all can put people at higher risk for having fatigue during and after their treatment. Certainly, if there are other co-occurring sleep difficulties going on, if somebody has restless leg syndrome, sleep apnea, insomnia going into their treatment, that's not likely to get terribly better with a cancer diagnosis. Nutritional imbalances, right? Folks who are not functioning well, and folks who have other medical conditions that are known to cause difficulties with thinking, like having anemia, having heart difficulties, having lung difficulties. And then there are a number of medications that can cause fatigue, and a number of treatments, chemotherapy, radiotherapy, surgeries. All of these can contribute to somebody's experience of fatigue and put you at increased risk. So how do we treat it? What do we need to do? Well, the first thing is always addressing the underlying medical causes that might be at play. So if you are somebody who's saying, if I had to rate my fatigue on a 0 to 9 scale, I'm pushing 4, 5, 6 or above, you certainly want to go into your doctor or your medical provider, let them know about that, because they're going to want to do basic blood panels, make sure you're not anemic, make sure there are sort of the basics are covered, and it's not something that that we can knock out pretty easily. Beyond that, we sort of have 2 options, pharmacological and non-pharmacological approaches to improving fatigue. And I'll touch on both. But as a psychologist who doesn't prescribe medicine, you can guess where I'm going to land in terms of what I find more helpful for patients, and actually what the data tend to show along those lines as well. So if we think about medical, pharmacological medicine interventions, these are broken down by efficacy, evidence of efficacy. We've got studies that show that they work. And then over here, it's where it's lacking, or maybe it doesn't work at all. So we just might not have the data yet to know whether this is working for folks. We haven't studied it well enough. And in some cases we know, yep, we've studied it and this is not terribly helpful. So the main category that we often think about are psychostimulants and wakefulness agents, right? So these are things like you think about for ADHD or attention deficit disorder, the same kinds of medications. Generally speaking, we think that they're more effective if patients have more severe fatigue. So if you're like, my fatigue's a 3, these agents don't tend to be quite as helpful. But methylphenidate, in terms of the number, the different types of medications, tends to have some more evidence. On the other hand, stimulants and wakefulness agents like Provigil don't tend to do as well for people who have more moderate or lower levels of fatigue. Antidepressants can be helpful in patients, particularly if they're experiencing that co-occurring mood difficulty that we often see in fatigue. Bupropion, or it's also known as Wellbutrin, tends to have some good evidence for its effectiveness. If your mood is great, if your mood is completely normal, but you have this fatigue, an antidepressant is probably not going to be as helpful to you. Corticosteroids are often used, but that's often sort of in the palliative setting. And then there really has not been any good data to show that there are any particular supplements that people should be taking, assuming that their sort of basic blood labs are normal. And modafinil or Provigil, the sort of awakening agents, don't tend to be terribly helpful. In terms of non-pharmacological types of treatments, the main sort of treatment on this end is aspects of cognitive behavioral therapy or cognitive behavioral therapy as a whole. And this is a type of sort of evidence-based talk therapy that it's very different than just sort of sharing your thoughts, having a supportive person to listen to your thoughts. This is really directed. It's almost, you get homework, you're sort of examining in a very systematic way your thoughts, the way that you appraise situations, looking for the evidence for and against various sort of inherent and trained ways of thinking about things, right? Learning how to restructure and reappraise situations, weigh the different options for interpretation, teaching relaxation strategies, teaching about sleep hygiene, doing basic things to help get you a little bit, preserve your energy when necessary and restrict sleep if there are sleep sort of timing problems for people. This sleep restriction is sort of getting you to the point where you're so tired that you really do sort of get back on track and start sleeping again in a more reasonable manner. Also exercise and yoga, which are sort of one and the same, but there are lots of different types of exercise and yoga that have been shown to be really helpful for treating fatigue. We have less evidence of efficacy for things like acupuncture, massage, or mindfulness-based interventions in terms of fatigue. I think that the mindfulness is actually something that we're learning more and more about, and I think that's probably about to switch columns over to the efficacious. We have more and more sort of well-performed scientific studies looking at meditation and mindfulness that tend to show that they're beneficial. And I'll just touch on one, it's not quite as recent as it used to be. I think this is 2018, late 2018 study in JAMA Oncology. So JAMA is a major medical journal. This is a meta-analysis, which is really takes a bunch of different studies of the same idea or same topic and puts them all together and runs the data analysis on the full set of literature that exists in the scientific community. And what they found is that for cancer-related fatigue, exercise and psychological interventions, whether you do just one or whether you combine them, are both really effective at reducing cancer-related fatigue. And this is the case if you're exercising or doing these psychological interventions during your treatment. If you are a survivor and your sort of treatment's far in the rearview mirror, they're still helpful for you as well. I think one of the great things is that the type of exercise you do doesn't seem to matter. So if you hate to run, you don't have to run. Finding something that you enjoy is really much more important than doing any particular type of exercise. And it can be yoga. It can be sort of more of a low stress and strain type of exercise, and that works just as well. For the psychological interventions, it is the case that the cognitive behavioral therapy approaches are particularly effective compared to other types of therapies. And I think really important is that both of these interventions, so doing exercise, doing psychological interventions, they work significantly better than medications, right? Which I think is really important because these are activities that reduce the likelihood of cancer recurring. The psychological interventions, you are, unlike taking a pill, which you have to do every day, and if you have another medical complication or you have to take another medication, you have to worry about interactions. When you learn a psychological skill or a technique or an ability, that sticks with you for life, and you can kind of keep pulling that back up. It's free. Once you've got it, once you've learned it, it's yours to keep. And so I think there are a lot of really nice sort of benefits to and it's nice that this is really empirically supported to these more accessible forms of intervention like exercise and psychotherapy. Okay, so switching gears a bit to sleep. So just to sort of reorient us to the notion of what our sleep topography is, sort of what does it look like as we sleep? So there's two types. There's non-rapid eye movement sleep and rapid eye movement sleep, or the REM. We see right, here we go, right here. And so the non-REM sleep is broken into stages. In stage 1, sort of your eyes are closed, but it's really easy to wake you up. It might only be 5 to 10 minutes that you're here. As you go to stage 2, you're in light sleep, your heart rate drops, your body temperature drops, you're getting ready to sort of fall off into the deep sleep stages here. And in stage 3, this is deep sleep. It's hard to arouse you when somebody wakes you up when you're in deep sleep. It'll take you a few moments to sort of reorient yourself, to feel like you know what's going on. And during these deeper stages of non-REM sleep, that's when the body repairs its tissues, regrows tissues, builds and sort of restores the system. So this is why it's really important for us to get to these deeper waves of sleep. And then you sort of dip down to deep sleep and you come back up and you hit the REM sleep area time frame. This usually happens about 90 minutes after you fall asleep. You'll have that first REM period. It's usually pretty brief. It might last only about 10 minutes before you dip back down again. And each of these REM stages becomes progressively longer throughout the night, so that, this last one might last up to an hour even, right? And so here your heart rate is quickening, you're dreaming, you're sort of acting things out in your mind. And this accounts for about 20% of your sleep, sort of altogether in general adulthood. So maintaining good sleep is really important for our physical and mental health and functioning. When we have poor sleep, we're at higher risk for having blood pressure elevations, which in turn puts us at the same time at higher risk for having heart attacks and strokes. It's harder to keep your weight regulated without good sleep. So you're more likely to put on weight when your sleep is poor. You're less productive, and related to that, your thinking is more poor when you're sleeping poorly. So it's important to get good sleep for a number of reasons, and not mentioned on here is just sort of emotional regulation, which I think is really key. When we go a long time without sleeping well, our ability to sort of keep it together emotionally, to think things through and respond as rationally as we normally would, is diminished. So how much do we really need? We all hear about sort of short sleepers, that some people are blessed with the need to only sleep 4 hours. And those people exist, and their biological set point tends to be about these shorter number of hours. But for the vast majority of adults, we really need 7 to 9 hours of sleep every night. And every night is really key. A lot of folks get into the habit of working really hard through the week and staying up late or getting up early and having this accumulating what's called a sleep debt. You're doing 6 hours or 5 hours some night over the course of the week, and then you get to the weekend and you think, I sleep in and that's going to get me back. It's really not a good approach. Our bodies don't work that way. We really do work on routine and consistency. And so we don't get the same benefits from sleeping our weekend away as we would if we just got a consistent 8 hours of sleep during the entirety of the week. So what are some healthy sleep habits? And these are things that have all been sort of supported by research. So keeping a regular schedule that relates to when you get up in the morning and go to sleep each night, having the same bedtime and wake time, but also trying to keep a reasonably normal schedule for things like meals, taking your medications, the time of day that you exercise, so that your body sort of habituates and gets into a routine and knows what's coming down the pike, right? It's also really, really key to have a wind down routine, to have a system in place, 30 to 60 minutes before you're going to be going to bed, that sort of sets the cues for your body and your mind that we're ramping up or we're ramping down, we're slowing down the day. So I have some young kids, and about, an hour before we go upstairs, I'm going around and I'm flipping off all the light switches. We're turning down any devices. Hopefully by then they're on books, but we're sort of dimming the stimuli throughout our household, and that sort of notion that everything is becoming quiet time. And so having a routine, whether you take your shower in the evening, whether you spend some time doing some stretching or reading, but having something that sort of is set apart from the rest of the day and begins that process for you. Other really important tips are trying to avoid daytime napping. If you have to nap, doing it before 3 o'clock tends to be important, and keeping it brief. Avoiding caffeine after lunch or after the noon hour, that can really stick with you all the way until 10 o'clock, 11 o'clock at night, and keep you from falling asleep, even if you had caffeine hours and hours earlier. And also avoiding alcohol within about 6 hours of bedtime. Alcohol will really help you fall asleep quite often, but the kicker is that it sort of makes you wake up in the middle of the night for a lot of folks. And so that's the difficulty, is it can help you get off to sleep, but then if you're waking up at 1 o'clock or 2 o'clock in the morning, that really is defeating the purpose. So I took this slide from the Hopkins sleep folks, and a lot of their tips are on their website as well that I'm going to present here today. And so setting the stage for a good night of sleep. And I really love this slide. I think it's great. So, looking at books or magazines and not screens can be really important, because of what do we know about the light that is emitted from our devices, that it can sort of stimulate us as opposed to help us calm down. We want our rooms to be dark. We're meant to sleep in the dark. And so having your alarm clock turned away from you, one, so that you're not monitoring the clock, but also so that the light, if it's too bright, isn't sort of right there next to you at the bedstand. If you need to get up in the middle of the night and don't want to, bang your toe, have a flashlight so that you're not turning on all the overhead lights to get into the bathroom and sort of waking yourself up. You want to be able to sort of do that without lighting up the house. Cooling the temperature. We sleep really well when in cooler rooms, so having it closer to 68 degrees can help facilitate sleep. Having good blinds and curtains to help get that outside light from shining in. Even things like making sure that you have good bedding. If you have very flat pillows or bedding that's making it physically uncomfortable for you to sleep, it can be important to replace those. To make sure that your sheets are washed on a regular basis, so that allergens are not interrupting your sleep, because they can cause stuffy noses and things that really end up keeping you from sleeping well. Keeping pets out of the bed. We have a COVID kitten that we've gotten over the last few months, and I can attest to this one. Having a creature in the bed while very snuggly, they tend to wake up in the middle of the night or shift and can be disruptive. If having clutter around is somewhat stressful or keeps you wound up, having decluttering your room a bit before you go to bed can be helpful, and also using white noise to help block out sort of ambient noises, right? And other aspects of good sleep habits are the basic notion that you shouldn't go to bed unless you're sleepy, right? If you've done your cool down routine, you're ready, the clock says it's time to go to bed, but you're, for whatever reason, just not ready, you shouldn't be going to bed. The bed should really be restricted for, intimacy and sleep. And so if you're not ready to go to bed, go do something else soothing, go read in another room. If you do go to, lay down in the bed and you find that after about 20 minutes, you're still not asleep, you should get up and do something sort of restful in another room. So go read, not in your bed, because we don't want your bed to sort of get paired with the idea of being active or alert or doing other things, but really go sit on your couch, sit in the other room, and do whatever it is you want to engage in to sort of wear yourself out, get tired, and then come back when you actually are sleepy. And then you also want to start the day right? So getting early sunlight is important. So what they say here is eat breakfast by a window. In Northern Europe, where they have such little light during certain times of the year, they actually have those bright lights that are good for your mood, that sort of get you alert, that are built into their showers, the shower ceiling, so that when they get up in the morning and take their shower, they're getting that early morning dose of light to help reset their sort of circadian rhythms. Interestingly enough, making your bed, people who make their bed tend to sleep better at night. So get up, make your bed. It's sort of part of that tidiness, perhaps. A lot of folks will say that exercising midday tends to be better for sleep. If you exercise very early in the morning, quite often it means you have to set that alarm earlier in order to get your exercise in, which can cut down on your sleep. Doing it too late at night can be arousing and kind of can keep you from falling asleep. So when you're able to do your exercise midday, that's often sort of the preferred timing. And as I said before, if you really have to nap, try to do it before 3 p.m. and try to keep it to under a half hour, so that you're not disrupting your sleep time later in the day. And one of the things that can really affect our sleep is stress, right? Thoughts and worries tend to come to mind when we have the peace and quiet of laying in bed. And so people can ruminate. They can sort of start chewing over their worries or thinking over the things that irritated them in the day, and it sort of keeps you up, keeps you busy. When you're stressed, you often have muscle tension and tightness and aches that can make it difficult to sleep. And also your heart rate tends to be higher, which is not really conducive to sort of the notion of calming sleep. And so there are a lot of different approaches to sort of treating stress to help improve your sleep. And all of these approaches, the goal is really to use your body's own natural relaxation response, which reduces the release of stress hormones like cortisol and endorphins, adrenaline, and helps slow down your breathing and your heart rate so that you're sort of shifting down into that lower mode of operating. There are a lot of different options. There's very gentle yoga, Tai Chi, meditation, that are really good at sort of helping treat that stress, give you something to de-stress at the end of the day. And I'll talk you through a few of these, deep breathing and progressive muscle relaxation. And so, for both of these, I would encourage folks to start by rating your level of relaxation on a 0 to 10 scale before you start. So kind of gauge yourself, how relaxed are you? If you want to get to a 10 where you're absolutely blissed out and relaxed, that's the goal, but where are you starting from? And you want to sit down and lie down comfortably in sort of a quiet place. And the goal here is to do just sort of some slow inhalation and exhalation for about 5 minutes, right? You want to be focusing on your breath. So you don't want to catch after you pull it in. You want to just sort of let it be that natural, slow rhythm of breathing in deeply, focusing on your breath, getting deep into your belly, and releasing it slowly back out for another, sort of 5 seconds in, 5 seconds out, or whatever feels comfortable to you. And you can add to that sort of something that's a soothing mantra. Breathing in, I'm calm. Breathing out, I'm coping. Breathing in, I'm calm. Breathing out, I'm coping. Or whatever sort of is calming and sort of settling to you. And you do that for about 5 minutes or longer at the end of the day. And then I'd encourage you to check back with yourself and rate your level of relaxation again and see if you don't feel a bit more relaxed after you've gone through that procedure. Another really helpful approach is progressive muscle relaxation, right? So again, you can rate your level of relaxation before you start. It's important to find sort of a quiet, comfortable place where you're going to be free from distractions. And you're going to take a few gentle cleansing breaths. And the notion here is to tense up one specific group of muscles, not your whole body, but one set of muscles at a time as you breathe, right? So you hold the tension as you inhale, squeezing very, very tight. So whatever body part if you're working on your arm, you're inhaling and you're tensing it as tightly as you can. And then you're breathing out and releasing. And as you release that tension that you've built up over the 5 or 6 seconds of inhaling and tensing, what you really want to be focusing on is that contrast, how relaxed each muscle feels. And so you do this in sort of a systematic way. Some people go from the head down. I go from the feet up. So I often will start with sort of feet and calves, tensing them. You could do both at one time or just one and then the other, but tensing, holding it for several seconds, feeling that tension, and then gently relaxing as you exhale and feeling that contrast as that part of your body relaxes. Then you move your way up from your calves and feet up to your legs, your thighs, your buttocks, your stomach and torso, your back, your hands and arms, your shoulders, your neck, and then even your face, making sort of one of those ugly scrunch up faces as hard as you can for 5 or 10 seconds as you breathe in, and then gently breathing back out and feeling that degree of tension that's released. And there are just a whole lot of different, if you just sort of Google progressive muscle relaxation, there are guided apps that can walk you through it, or guided programs on YouTube. There are different charts and figures to tell you, which body part to do next if you're somebody who wants to sort of follow along. So there's a lot out there, but it's completely free and very effective at helping us sort of calm ourselves and de-stress at the end of the day. When you're finding that those worries are sort of in your mind and you're not able to shake them, something that is actually a really interesting and sort of fun, consistent scientific finding is that writing about your difficulties, journaling, or even just creating a list is very, very therapeutic. It helps people minimize their anxiety by writing it down. And so I'll often tell people that if you're finding yourself laying there and you're worrying or you're concerned, what you should be doing is have your pad of paper next to it. If you want to take some time and actually journal and write about what's worrying you, that's excellent. But another option is also just to sort of jot down, okay, I'm worried about X, Y, and Z. Think about what your schedule is tomorrow and say, you know what, I'm going to put my worrying down on my calendar for the ride into work tomorrow from 8 to 8:30. That's when I'm going to devote my time to thinking about these things and worrying about them. You set them aside, you give them their place on your schedule. They're going to you're going to problem solve, you're going to sort of hash them out mentally like you need to do, but it's not going to be right now, because right now there's a different task, and that's sort of resting and getting to sleep. And on the other side of the, sort of focusing on the worries and getting those taken care of is spending some time thinking or writing about what you're grateful for. Making a list of things that you're grateful for that happened throughout the day, that have happened in your life, things that you want to make sure that are sort of at the fore of your mind, can also be a really great way to sort of unravel that knot of stress and tension as we're trying to get set to go to sleep. In terms of other tools to help with sleep, melatonin, most people know about. You can buy it at the grocery store. It's a supplement. And it's important that people know that this isn't a sleep aid like Ambien or Lunesta. This isn't something that's supposed to help kick you off into sleep. What its purpose is actually to anchor your circadian rhythms, to get you back into having that normal sort of sleep cycle, sleep schedule. It should not be used sort of nightly to help you fall asleep. It shouldn't be used for more than a few weeks. And it's also important to note that most of the research on melatonin has been done in animals. It's a lot less has been done actually in humans in terms of actual scientific studies, even though, you know, you can go find 5 different brands of it on your grocery store shelves. We don't really know what its consequences are when people are using it, particularly for long periods of time. So that is something to keep in mind. In terms of sleep aids, so these are things like Ambien and Lunesta, I really do encourage people to start with lifestyle changes. Medications are not benign, right? They can interfere with your other prescribed medications. They interfere with alcohol. They can have side effects like headaches. They often have antihistamines, which are things we're not supposed to be taking, you know, day in, day out for long periods of time. Antihistamines can cause dizziness, cognitive difficulties the next day, right? You can feel groggy and sleepy the next day, which isn't helpful. Taking sleep aids, you know, raises the risk for nighttime falls, particularly in people who are older. And some of the sort of older sleep agents that people have used do have the potential for addiction. And so, you know, those are all things to sort of keep in mind. And also that these are supposed to be used for short periods of time. There have been some studies looking at whether things like Ambien and Lunesta are associated with potentially increased risk for dementia in people who take them for sort of longer periods of time. And so there's some indication that it might not be good for your sleep to take them long term. Okay, so when to talk to your doctor? When is it, you know, that you should be saying, you know what, this is certainly something that I need to take care of. If you're having difficulty with your sleep, and like I said, if you're sort of rating your sleep as 4, 5, 6 out of 10 in terms of your fatigue during the day, then that's something you should probably check in with your doctor, let them know if you're getting enough hours of sleep, but you're still feeling tired. If you're having problems with snoring, or if your bed partner says that you're gasping, you may have sleep apnea, which is bad for your, you know, thinking skills, in addition to just your ability to get a restless night's sleep. People who have restless leg syndrome, the sort of creepy crawlies, REM sleep behavior disorder. So if your bed partner is telling you that you are kicking, thrashing, acting out in your sleep, that's something that you want to make sure that your primary care doctor is aware of. And then, of course, if you have insomnia, and that's the last little thing I'm going to talk about here before we open it up to questions. We know that insomnia is more common in women, people who have weird work hours, sort of unclear work hours, or shift workers, people who have a history of depression or who don't exercise, they're all more likely to have insomnia. And insomnia isn't just difficulty falling asleep, it's also staying asleep or waking up way too early in the morning and not being able to get back to sleep. About 1 in 3 adults will have acute insomnia where it lasts a few days at a time. That's not terribly uncommon, but about 1 in 10 individuals will have insomnia that is sort of chronic. They're having it 4 or more nights a week. It lasts for more than a month. It's really sort of a very distressing part of their nightlife. And so I'll just end with some of the resources that are available. In addition to obviously talking to your medical provider, if it's any of the things we've discussed, there are some nice apps out there. This is the CBTI Coach, which is Cognitive Behavioral Therapy for Insomnia, which is an empirically or scientifically sort of studied way of coaching people through insomnia. And then our Hopkins Behavioral Sleep Medicine program is fabulous. They can do all of the sleep studies to make sure, you know, you don't have apnea or all of these other things, but they also work with you to help start that cognitive behavioral therapy and get you and your sleep schedule on the right track. And so that is all I have. I'm happy to answer any questions.
Dr. Vannorsdall, thank you so much. I always enjoy hearing you talk, and every time I hear you talk, I learn so much. So I just want to thank you very much for all of the great information that you've shared with us. We are getting a lot of great questions. Just as a reminder to use the chat feature that you see in the middle of your screen, and you can chat with me directly, send me a question. We'll get to as many questions as we can in the next 10 minutes or so. I was just, as you were talking, I was going through and taking notes, and just some of the things that struck me is I liked how you started with saying the importance of structure and routine. And I think that that is something that I'm definitely hearing from patients right now, and especially given our current situation, that people are not getting up and going to work the way that they normally did, and they're staying up later. And so it is much more of a challenge, I think, to sort of find that routine. But it sounds like now more than ever, that routine is really important. And the idea also of this mantra of calm and coping, I think that's all sort of words of wisdom we could take away right now, given that we're sort of doing this for the long haul. I was also thinking a lot about what you were saying about the types of fatigue. And I think for me personally and for patients that I work with, it's helpful to have that language between the difference of physical fatigue, cognitive fatigue, and through that motivational piece. And so when we're talking to our providers, I think it's really helpful to say, I physically can't go on, or my body is strong, but mentally I'm just sort of, I say sometimes when I get home, I have nothing left to give you people when I walk in the door, sort of that mental piece of it. So I think that's really helpful. And then knowing that fatigue is subjective, I think is also really important. And I know that when I talk to patients, that we could give some patients the exact same treatment, and it's just handled differently by different types of patients. And so for some people, the fatigue could be debilitating, and for others, it's just slightly annoying. But then hearing from you that validation that upwards of 80 to 100% of patients experiencing that, at least from my optic, it definitely makes me sort of say, we need to do a better job of sort of talking about this early, preparing patients and giving them resources, given how prevalent it is. And if there are resources, again, that, not necessarily running straight to the pharmaceutical piece of it, but the things like exercise and meditation. I was also thinking about the sunlight piece. I know in my current life, I get up, and honestly, sometimes I start the computer first thing in the morning and I don't see sunlight all day, and I'm literally working in a closet sometimes with my current situation. So, noticing that that's a very small change, a behavioral change that you can do to help with some of these things. So that's sort of, from a nutshell for me, some of the great pieces that I took away. I'm going to get to some of the questions that we've been getting. So one question that we had was, how do you know when it's time to rest and when it's time to push through? And I know that I've been asked this in a couple different ways, but how do you know when you sort of listen to your body, which we're trying to teach patients, and say, look, it's time for that nap, and also saying, yeah, probably you're sleeping too much and that may be affecting what's happening at night?
Yeah, I think that sort of goes back to the structure. And if you're doing the things that you should be doing, if you're setting yourself a routine and you are going to bed at the right time and trying to get those good 8 hours of sleep, and you're feeling like you're hitting a wall, then, listening to your body or listening to your cognitive complaints and fatigue, certainly seems warranted. We don't want folks to feel like they have to push themselves or to prove something to someone or to themselves if their body is telling them that they are needing a break. And like I started with, fatigue is a signal. It's your body saying, hey, we're doing something else here. We need to put our energies elsewhere for a minute. And so we're evolutionarily designed to sort of pull back and let our body sort of take care of the healing process when we're sort of coming down with something, as a classic example. So
yeah, no, I think that's really helpful. And the idea of teaching, I think as women, a lot of times listening to our bodies is really challenging, and sort of we push through and sort of we look at that as being heroic. And I think, at least from my experience, I sort of know that the more I listen to my body, the better off I'm going to be, and sort of the more heroic I'll be in other areas of my life. So,
and sleep is so fundamental that when we don't get good sleep, we can't do all the things. We're not as productive. We're not as emotionally present and able to handle the rough spots, and we're not thinking as clearly, and that becomes a frustration when we make mistakes. And so it really ends up being sort of a bedrock of our ability to function well in a lot of other areas, I think.
Yeah, no, that makes a lot of sense. We're getting some questions, and I know this really resonated with me, this idea of having a routine. And it definitely struck me when you were talking about having children in the home. And I remember when my kids were little, a pediatrician telling us, you should do dinner and then a bath. And so you're signaling to a baby when you're sleep training them how important it is that we do these things and then you go to bed. And we forget that as adults. And so, I know a lot of patients, have computers or iPads in bed with them. And so the idea of sort of training your body to know that this is what we do before we go to bed and then we sleep, I think is really helpful advice. So another question that we're getting is on through this rage, and maybe it's less popular now, but these mobile tracking devices like Fitbits and other things. And so one person that's watching wants to know a little bit about, does monitoring your sleep, do you take real information from that? And is that helpful information to sort of make different behavioral changes in your life?
Yeah, so generally speaking, monitoring what your behaviors tends to be good for engaging in good health behaviors. If you track your steps, if you track your what you're eating. You tend to lose weight when you track what you're eating, right? You tend to exercise more when you have to write it down. And having data on your sleep can be helpful as well. We can often get more than we can really ingest or sort of meaningfully take in from some of these apps. And for some people, it becomes, sort of like having that alarm clock facing you where you say, oh my gosh, it's 1:05 a.m. It becomes anxiety provoking. And if that's how you tend to be with it, then I wouldn't push people to necessarily track very thoroughly if it becomes anxiety producing for them. But for others, it can be really nice to sort of know where you're at and start looking for correlations in your life. You know what, I've had a few bad days of sleep and these other things are going wrong, or I'm taking care of my sleep and I'm also eating healthier and exercising and my sleep is better. And sort of, it gives you things to sort of benchmark off of one another.
Well, that idea of accountability, it sounds like that you're sort of having to, if you look at all of it, then you can't sort of not look it in the mirror and sort of deny what's going on. Sure. You mentioned things like food just a minute ago. We had a question. I know you mentioned caffeine in your talk, but are there other things like spicy foods, or I've heard some patients ask questions about MSG, for instance, which is in a lot of foods. Are there things that you recommend if you're struggling with fatigue or struggling with getting a good night's sleep that you would recommend staying away from beyond sort of the traditional caffeine?
You know what? There's nothing that comes to my mind. Certainly nicotine is a stimulant. So a lot of folks who are smokers, if you're going to be sort of regulating your smoking, probably trying to cut back the evening cigarettes first might be a good idea because it is a psychostimulant.
Sure. No, that makes a lot of sense. So one question that we're getting is from someone who's saying, does the time of sleep matter? So does it make a difference if you sleep, let's say at 10 p.m. versus midnight, if you're still getting that 7 to 9 hours? Does when you get it make a difference as long as it's sort of at night, ideally, and it's with your circadian rhythm?
Probably not, as long as you're getting enough daytime sunlight, right?
Yeah.
And that it's consistent. But if there are sort of what's called a sleep phase cycle disorders where people are sleeping during the day and awake all night, that's something that you need to be, seeing your doctor about, because that can be really, a challenge and have consequences. But if people are a 9 p.m. bedtime versus a midnight bedtime and they're still getting those 8 hours, I think that there's definitely not a one size fits all.
Sure. No, that makes sense. You mentioned in your talk inflammation, and we had some questions about, I think that's definitely something that we're a lot more cognizant in the cancer world about, the role of inflammation in cancer. Are there things that we can do to maybe not turn back the clock, but address inflammation? I thought the data that you showed was sort of really interesting about inflammation markers and what happens 5 years later. What can we tell patients if they're worried about inflammation as sort of a response to life?
Right. So, that's a great question. And I don't know if I have a scientific answer for you. There are sort of anti-inflammatory things like NSAIDs, and, there are lots of foods that are said to be anti-inflammatory, thinking about berries and things like that, which are often quite healthy. So it doesn't seem to be a bad idea to try to eat in a way that sort of minimizes processed foods that are associated with more inflammation, and eat a more natural plant-based diet, which is associated with lower levels of inflammation. But I don't know if there are any particular sort of key, every food says, pomegranate is the key or blueberries are the key. And I don't know if there's anything that really says, I'm the best.
Yeah. I feel like that data sort of is a buzzword, and it changes a lot. And we probably could do a whole webinar just on the role of inflammation. And there's so much information out there, and probably a lot of myths as well that we could work on. We just got a question about, is there such thing as too much sleep? So if you're going over that 9 hour mark, does it have the opposite effect, and then you sort of have trouble the next day with fatigue over time?
So if getting your sleep out of whack is a problem sort of in either direction. So if you're sleeping too much, obviously then it can mess up your schedule the next day. But there are also certain conditions, depression being one, where people can become very, very somnolent. They're sleeping or staying in bed massive, numbers of hours during the day. And there's, I'm in bed 12 hours a day or 15 hours a day, and I'm tired and I'm just sort of nodding on and off. So that can be a sign that something else is going on if you're sleeping way too much. But more generally, having one night of, really long sleep then can mess up your ability to fall asleep the next night.
That's helpful. I know we're almost out of time. I have one more question that I want to try to get to. We're getting some questions about sleep aids. I know you mentioned things like Ambien, Lunesta. Definitely getting a question right now about medical marijuana and the role of sleep with that, helping with going to sleep and staying asleep. What are your thoughts on things like that? And does that impact that very beginning that you showed that chart, that REM cycle chart? Are you still going through the normal cycles? And I guess the follow-up question, what are your thoughts on medical marijuana when it comes to sleep if you're having really
Yeah. I think it's a really understudied area right now. I think that we know some about sort of illicit marijuana, the older scientific literature on how it affects sleep. In some folks, it can lead to anxiety, not just that sort of temporary anxiety, but it can heighten anxiety more broadly in individuals when they're smoking marijuana, particularly before bed. And it can disrupt the sleep in some folks. But there have been so many changes in marijuana over the past even 20 years. So the THC concentrations in the 1990s of marijuana that was smoked versus what I say kids nowadays have access to, it's an exponential growth. It's much, much more powerful THC. And then there's the entire medicinal world where people can get different agents that are much more calming versus stimulating. And so I think that is uncharted waters right now in terms of what is truly going on and what is helpful for a given individual.
Sure, that makes a lot of sense. Sounds like a lot more to be coming down the pike on that as well.
Yeah, I certainly hope.
Dr. Vannorsdall, I feel like I could talk to you all night, but I want to be sensitive to the time. For those of you who are watching and you want to watch this great presentation again, I know there's a lot of great data that Dr. Vannorsdall showed. We're recording this, and I'll have it out to you guys in the next several days. Tracy, if I could ask you if you could just stop sharing your screen for 1 second. I just want to go through a couple very quick, quick housekeeping things. So just as a follow-up, again, thank you for joining us. Wanted to let everybody know about upcoming webinars we have coming up. Dr. Vannorsdall talked a lot about mindfulness and meditation and how that can definitely impact sleep, and maybe moving to that other column that she mentioned about there's good data to suggest that could help. So I think we could all use a little bit of meditation and mindfulness in our life, given the world that we're living in right now. That's coming up next month with Netta Gold, and we'll be doing that same time. Additionally, we'll be in September. We have a new faculty member here in physical medicine and rehabilitation who's going to be doing a NIA webinar, which is just really interesting. If you don't know, combination of free-flowing dance, martial arts. I think it'll be a wonderful experience. And finally, coming in October, we're going to be doing yoga therapy, looking at ways to sort of incorporate movement and in terms of relaxation and strength training and improving overall health and wellness. So if you're interested in registering for any of these webinars, of course, they're always free. You can link to right here on our website and register as you registered for this previous one. And finally, just real quick, just wanted to remind everybody, I'll be sending this link out as well, but we'd love for you to take our satisfaction evaluation survey. This will take about less than 30 seconds. We just want to know how we did, other topics you'd like to hear from us, how we can improve, and what else we can do for you. So I know that was a whirlwind. We went really fast, but I'd like to thank you for joining us this evening. Dr. Vannorsdall, thank you so much again. A wonderful presentation. I know I got a lot out of it, and our comments are showing other people did too. So thank you again for doing this. And I know evenings and bedtime are tough, so I appreciate you joining us so late in the evening. But it was wonderful. So hope everybody has a great evening, and thanks.